What is in vitro fertilization? In vitro fertilization, or IVF, is the most effective assisted reproductive technology, or ART, to help couples facing fertility issues have babies. Also known as the test tube baby procedure, IVF involves retrieving eggs from a woman's ovaries and fertilizing them with sperm and assist the fertilized egg implant in the uterus to form pregnancy. IVF key facts. One IVF cycle can take 3 to 6 weeks. IVF may involve multiple cycles. Patience is important. Additional treatments and techniques along with IVF increases the chances to conceive. IVF is performed to help intending parents with fertility or prevent genetic problems and assist with the conception of a child. It is performed for reduced fertility in women due to advanced maternal age, diminished ovarian reserve, ovulation disorders, blocked or damaged fallopian tubes, endometriosis, low sperm count or abnormalities in sperm shape that contributes to male infertility. To avoid risk of passing a genetic disorder from the parents onto their offspring. Fertility preservation in case of cancer or other health conditions. Unexplained infertility. History of recurrent miscarriage. Previous unsuccessful IUI. PCOS. In vitro fertilization, or IVF, is almost a household word today. It is a boon to those infertile couples dreaming of beginning to form a family. The average IVF success rate is around 40% in young women across the globe. However, chance of success rates is high in women younger than 34 years of age. IVF success rate is usually measured on the basis of take-home chances per attempt. Average IVF success rates are: women with anti-Mullerian hormone or AMH more than 1.2 and age less than 34, 50% take-home chances per attempt. Women with AMH less than 1.2 and age less than 34, 23% take-home chances per attempt. Women with AMH more than 1.2 and age more than 34, 30% take-home chances per attempt. Women with AMH less than 1.2 and age more than 34, 14% take-home chances per attempt in women with age less than 37 and 4% take-home chances per attempt in women with age more than 37. Donor egg cycle irrespective of age with single embryo transfer, 48% take-home chances per attempt. Donor egg cycle irrespective of age with double embryo transfer, 71% take-home chances per attempt. IVF is one of the most effective assisted reproductive technologies today, but whether or not it will work for you relies on a variety of factors. There are a few key criteria that can influence the probability of a successful IVF treatment. These are: maternal age, type of fertility problem a couple is facing, history of previous pregnancy issues, quality of egg, sperm and embryo, controlled ovarian stimulation protocol followed in the IVF cycle, uterine or endometrial receptivity, laboratory proficiency of the IVF center, experience and competence of the consulting fertility doctor, embryologist and other assisting medical technicians, accuracy of the embryo transfer, the patient's lifestyle, post-transfer luteal support. Based on the information out of investigations like ovarian reserve testing, tubal patency, semen evaluation, prolactin test, infection screening, or sometimes a mock embryo transfer, the doctor decides on the ideal medications and regime the patient should follow during the IVF process. IVF is performed by a combination of medicines and surgical procedures to help the sperm fertilize an egg and implant the fertilized egg in your uterus. The doctor takes the eggs out of your body, puts the eggs together with the sperm in a lab to fertilize them. Once one or more fertilized eggs or embryos are formed, the doctor directly implants the embryo or embryos into your uterus for the pregnancy to happen. The doctor may prescribe you medications and certain routine cares to increase the chances of implantation and pregnancy. Intracytoplasmic sperm injection or ICSI, a subset of IVF, could be a ray of hope if conventional IVF treatments are not helping. Also, the freeze-all procedure, in which embryos created using ICSI or traditional IVF are frozen rather than eggs. Endometrial receptivity analysis or ERA also helps avoiding recurrent implantation failure by monitoring the endometrium at a molecular level. Apart from this, pre-implantation genetic screening or PGS improves the chances of implantation avoiding failures occurred due to chromosal anomalies in the embryos. Despite its increasing public attention, there are still plenty of myths about IVF. Some of these misconceptions are that IVF is only for infertile couples. A couple can go for IVF at any age. IVF causes multiple childbirths. IVF is the only way to have a baby for infertile couples. Fertility drugs cause cancer. IVF always works. Serious complications from the IVF procedure or medicines are rare. However, there can be possible side effects of injectable fertility medicines, risks of the egg retrieval or embryo transfer, and pregnancy that include risk of multiple pregnancies, risk of low birth weight and premature birth, ectopic pregnancy when the eggs implant outside the uterus, ovarian hyperstimulation syndrome or OHSS that involves nausea, bloating or ovarian discomfort,